Medication-assisted treatment, or MAT, makes a huge difference for many people dealing with opioid dependence or addiction. But there's a lot of stigma and misinformation out there about MAT and the medications used in it. One question we often hear is, does Suboxone get you high? If so, won't it just be a new addiction? The short answer is no, Suboxone does not get you high. The longer answer involves a little science. The brain has 3 types of opioid receptors that are named after Greek letters: mu, delta, and kappa. These receptors have different roles, but the one we're going to focus on is mu. Mu receptors impact the ways we feel pleasure and pain, as well as a lot of other functions. A substance that binds to the mu receptors in the brain and activates them is called an opioid agonist. This includes the opioids that people take for pain relief and recreationally, like morphine, heroin, Vicodin, and fentanyl. Some substances bind to those same mu receptors, but activate them less strongly. These are called partial opioid agonists. Buprenorphine, the main medication in Suboxone, is a partial agonist. It forms a tight bond with the mu receptors, but it doesn't fully activate them, so it does not create the rush of pleasure or high that full opioid agonists can. Some people do feel mild euphoria when they first begin taking buprenorphine, but most people adapt to it quickly and stop feeling any euphoria when they take their dose. Even when you increase the dose of buprenorphine, the effects plateau. Taking more doesn't get you any higher. This is called a ceiling effect. Because buprenorphine is partially activating the brain's mu receptors, cravings for opioids are greatly reduced or eliminated. And because of the ceiling effect, a person isn't driven to seek more and more of the substance the way they are in addiction. This gives people a chance to get their lives back on track, repairing the damage that opioid use disorder may have done to their relationships, finances, jobs, and health. It can take years for the brain to recover from opioid use disorder, and for a person to learn new coping skills and healthier habits. But taking buprenorphine, even long-term, does not meet the diagnostic criteria for addiction. So, Suboxone does not get you high, and it is not just trading one addiction for another. Learn more about opioid use disorder and medication-assisted treatment like Suboxone at workithealth.com.